brunnstorm approach. We are going to discuss brunnstorm approach. Brunnstorm approach is one of the sensory motor approach, and in many cases it happens that such as hemiplegia, we use brunnstorm approach for the recovery of the patient and for the treatment protocol. What is brunnstorm approach? It is a neurophysiological approach that is dependent on reflex control theory and hierarchical control theory. What is a reflex control theory? Reflexes are building block to complex motor control in hemiplegia. Afferent sensory input are necessary prerequisite for reflex controlled initiation and efferent motor output. For example, in flaccid stage of hemiplegia, initial focus must on the reflexive movement via certain sensory stimulation contradictory to NDD. Hierarchical theory states with higher central control on lower center. In normal individual, there occur a smooth, controlled and purposeful movement because there is a presence of control from higher center on lower center. When higher center damaged, the movement becomes reflexive and less controlled. Just look at this pyramidal picture. Cerebral cortex, midbrain, brainstem and spinal cerebral cortex through planning and execution of purposeful movement. What midbrain do? Eye-head coordination and head-writing reaction. What brainstem and spinal cord do? Primitive reflexes or withdrawal reflexes. Okay, now we'll talk about synergies. Most treatment offered to stroke patient will focus on inhibiting atypical muscle strength, synergy and movement. Please keep remember brainstorm approach we use in stroke patient when there is synergies. Brainstorm approach uses abnormal pattern to develop voluntary motor control. If we talk about the aim of brainstorm approach, then it is a development of synergy and reflex pattern in spastic muscle, and once it develops, then break it. There are some assumptions. Brainstorm made assumption regarding the motor control and reactions to stroke patient to form a basis for the principle of movement strategies. In normal development, reflexes become modified into purposeful movement, and the recovery in stroke appear to result development in reverse as reflexes are used to facilitate or to learn purposeful movement. It may well be that a subcortical motion synergies which can be elicited on a reflex basis may serve as a wedge by means of which limited amount of build amounts can be learned. Repetition is a must-learn movement. Practice in context of ADLs enhances learning. In our upcoming video, we will discuss about the basic limb synergies that may be either flexor synergies, extensor or mixed synergies when your body after flaccid becomes spastic and adopt the pattern. It appeared during the early spastic period of recovery. Mass movement pattern in response to stimulus or voluntary effort or flow. So in our next video, we will discuss about the flexor and extensor limb synergy. So that was all about this. Thank you so much.